I am Dr. Suri, Chairman, Medeor JCS Institute of Pulmonary Critical Care and Sleep Medicine at Medeor Group of Hospital, a unit of VPS Healthcare. COVID-19, the disease which is caused by novel coronavirus, has gripped most countries of the world. This disease started in the Wuhan city of China, and subsequently it rapidly spread to Europe, USA, and now it has also entered into India. This disease, if you see from the reports from Wuhan, has caused significant morbidity and mortality. That means it has caused extensive disease and death, and the same has also been seen in patients in Italy. Luckily, the disease, what we see in India at the moment, is in the early stages, and we have not seen many severe cases and deaths at the moment. As our experience with the other countries like China, Italy, the disease has spread very rapidly, and it has become quite a serious problem with lot of patients on ventilator and lot of deaths. Now, if we have to prevent the same thing here in India, it is very important that we have to take early and effective steps. The government has already introduced important and necessary steps which are to be taken at this stage of the disease, but it is very important for the citizens of the India to understand and cooperate in these measures to prevent the spread of this disease into the community. To do so, it is very important that first we should understand how this disease spreads. So for a common person to help and support in the preventive measures, they must know the basic aspect of coronavirus disease and its spread. Coronavirus mainly affects our lungs, and it is primarily a disease of respiratory system where the infected person develops cough, breathlessness, pain chest. In most of these cases, they also develop high-grade fever. Now, when these patients cough or even when they talk, they generate or produce a kind of spray. It's a spray which consists of our salivary secretions and the secretions coming out of the lungs. Now, this spray contains droplets, and these droplets carries the viral particles, this thing. Now, it has been seen that when a patient coughs, this spray has particles which are quite heavy enough that they do not normally go beyond 3 feet distance. So, if a person is within that 3 feet, then you are likely to inhale those droplets and carry that infection to you. Otherwise, this spray has a tendency to fall on the surfaces close to the patient. They can be tabletop, they can be any other surface. They can be, if you are coughing, and it can be your hands, it can be your clothes. So these viruses, they can settle on these and produce a kind of a thin film. Now, these viruses can stay and live and remain alive for few hours to few days in these surfaces. If you happen to touch these surfaces during this period, then you can carry this viral infection with you and in your hands. And if you then finally touch your face, touch your nose or your mouth, these viruses can be transferred into your mucous membranes, and then you can get the infection. Once a patient gets infected with coronavirus, the common symptoms are dry cough, because it involves your lower respiratory tract, lower respiratory system, your lungs, and in some cases it can also involve the upper respiratory tract, in which you can develop sneezing, running nose, blocked nose or sore throat. But by and large, it is dry cough, pain chest, and once extensive lung involvement has taken place, the patient can develop breathlessness. And the another important symptom is fever, which can be mild to moderate. It has been seen about 24 to 80% of the patients will develop fever. But there are some patients who may not develop fever. So absence of fever does not rule out that yes, it can be very serious, as you can see from number of hospitalizations, number of deaths which we have seen both in Wuhan city and Italy. But good thing is that majority of the patient, that means 80% of the patients will develop mild disease, and this mild disease can be self-limiting and most of these people recover. But the important thing is that during this phase of recovery, they can transmit infection to other people. But 20% of the people may develop more serious form of disease, out of which 10% may have to be admitted in the hospital and 5% of them may require ICU care and mechanical ventilation. The patients who are likely to develop serious disease are the one who are elderly, those who are suffering from chronic diseases like diabetes, heart disease, hypertension, and those who are on immunosuppressive drugs. So it's very important to segregate these people during this period of epidemic so that they do not develop, they do not catch this infection. So by protecting this group, the main reason for spread of infection is through droplet infection, one, when the infected person coughs, and the second is through the infection through the surfaces or through what we call fomites, when somebody touches the dirty surfaces where the virus is residing. So these are the two main sources of infection. So one very important thing is that you do not come in contact with a person, I would say close contact with a person who is having symptoms. So as I said that when these patients cough, the spray does not go beyond 3 feet. So you should keep a minimum distance of 3 to 6 feet from such patients. So this is what we call as social distancing. So social distancing is that not coming in close contact with people who are likely to be suffering from this kind of problem. So what does that mean? That means that you should avoid going to places where you cannot have this kind of social distancing, like traveling in busy buses, traveling in trains, going to crowded places, or going to congregations, religious congregation, social congregation, all types of situation where you are not very sure what kind of people are there, what is their background, what kind of illness they may be having. So if you happen to go visit these places, shopping malls, crowded markets, so where you can come in close contact with these kind of people and develop the infection. So that is what we call as social distancing. And in the initial phases, when we are controlling this disease, we try to take all these patients who are suffering from the disease to an isolated areas and try to trace their contacts and make a close watch on this thing for development of symptoms. So I say the only and the most important thing in such situation is the social distancing. The second aspect is the spread of infection on certain articles which are frequently touched by people, like door handles, like electrical switches, or you go in a lift, those switches are there. So it is very important to frequently wash your hands, particularly when you are touching the objects which are frequently touched by a lot of people. So this is another very important source which can transmit infection in most of these cases. So frequent hand washing, and now there is a definite method for washing hands. You can use common soap and water. You should at least wash for 20 seconds to effectively clean your hands. Wherever water and soap is not available, you can use a alcohol hand rub, which should have at least 70% of ethylene alcohol, and that can be used in such situations. It is important that you should not use these rubs when your hands are visibly dirty. So then you have to use soap and water. So I think these two important things: don't shake hands with people, don't hug, because these viruses may be present in the on the clothes of these people. So these, I think, two important things are there. But the another thing is that if suppose you have come in contact with someone who has been suffering or who has been having symptoms and who is a confirmed case of COVID-19, in that case, there is every chance that you have acquired infection with that person. So you should go into a self-quarantine, and you should, because the incubation period, that is the time taken for you to develop symptoms after you have acquired infection, in most of the cases it is 4 to 6 days, but it has been seen that this can be up to a period of 2 weeks. So it's very important that in such situation, if you have come in contact, or if there is a chance that you might have come in contact with such patient while you have been, say, you have a recent travel to those countries where already community spread has taken place, then you should go into a 2 weeks self quarantine where you should stay in a separate room, you should wear a mask, you should frequently wash your hands, and you should keep a minimum of 6 feet of distance from your family members. So this is a very, very important thing, which you have to observe. Now, second thing, so this is for your personal protection. Second thing, if you develop symptoms, suppose, in that case, you should go to your nearest designated center. You should show yourself to the doctor. They may likely to do your test. And if you are found to be positive, then according to the guidelines, you will be treated and maybe isolated. And that is the second part. The next thing is that it is very important that your family members, particularly those people who are older than 60 years, they should remain indoors. So during this period of epidemic, it is important to not go outside unless it is very essential. You should not go to the crowded places or any places where there is a risk of getting an infection. So if suppose you cannot avoid going, then you must wear a surgical mask. This is usually a 3-layered mask which you should wear while traveling or while coming in contact with the people. Otherwise, at home, if you are not symptomatic, you need not wear this mask. The third thing is, if any of your family member develops any symptom, then immediately you should take them to the hospital or to the doctors and get themselves adequately checked up. So by observing these measures, then you will be serving your role in not transmitting disease to other people and to other part of the members of the society, and you will be able to somehow help in preventing the transmission of this disease to others. And the last thing which I would like to tell, that don't panic, be aware, and after understanding about the disease, knowing about this information, you try to follow it in letter and spirit. And I am sure if we follow this and by supporting this to the government measures which are being in place, we will definitely be able to reduce the impact of this disease in our country, as we are seeing in countries like Italy or China.
Thank you.
Thank you.
Thank you.